Okay, I guess that's us live.
Good evening.
Right, good evening, Rabbi. How are you?
Yes, Baruch Hashem, how are you?
I'm very well, thank you. Very well. Thank you to everybody that's joining us tonight. We're going to wait just a few seconds, perhaps a minute or two, for the audience to build up a little bit before we begin. But tonight, our subject is Jewish and medical perspectives on organ donation, because we decided to choose all the easy topics, didn't we, Rabbi?
Well, we figured that the easy topics are the ones that people want to hear. The hard ones, nobody really wants to hear anything about.
But this has obviously been something that has been in the press quite a bit, because the legislation surrounding organ donation changed. And so that now brings this subject to the fore again. And Laura Greenberg's there. Hello, good evening, Laura.
Hi.
Mike is late for dinner. Mike, your dinner's getting burnt. Please hurry home if you're watching this. But no, this subject matter is obviously a very important subject matter, which we don't seem to talk about enough, given the the seriousness of it and the fact that it can make such a massive impact to so many different people. Good evening, Elaine and Richard.
I see they're here from YouTube, so that means that's working tonight.
It's working tonight as well. So I think we've ironed out our technical glitches. We have 31 people with us at the moment. So I think that means we can get into it. So yeah, to recap, we chose this subject because, again, it's become more relevant, and it's something that a lot of our congregants have been talking about, and I know they've approached you personally to discuss this issue. Tonight, to give us that medical perspective, we are joined by a special guest that I'm going to bring in now. Just one moment. Good evening, Jeremy. How are you?
Good evening, David. How are you doing?
We're doing very well, thank you. Thank you very much for giving of your time to us this evening. Jeremy, for those people that don't know you, you are an active transplant surgeon at the moment in Hammersmith Hospital, I believe. Is that right?
Yes, I'm a transplant and vascular surgeon. That's at Imperial College Healthcare, and my main base is the Hammersmith Hospital in West London.
And I came across your name, and it seemed like a familiar name, because anybody that sort of grew up in Prestwich has probably been treated by your dad at some point when he was my GP as a kid. So obviously the name was very familiar, and we reached out to you. But you're on the medical advisory board of the Jewish Organ Donation Association. And how many of this organization, how many of you are there? How does it work?
Well, it's a handful of transplant professionals, physicians and surgeons. And it's essentially to break down the barriers when it comes to Jewish people being organ donors, and particularly breaking down a lot of myths that exist out there, which I'm sure we're going to cover a bit later this evening.
Yes, we will. As a surgeon, obviously you've just gone through. We're in the middle of coronavirus and all the different ramifications that's had on healthcare and the strain that it's put on the system. What has that meant for you as a transplant surgeon? Have things had to be put on hold, or are you still carrying on?
So I personally do kidney and pancreas transplantation, and we stopped very early on because we were worried, because we were hearing some really horrific stories from patients that have had transplants recently from around the country. And I think a lot of the other units followed suit straight away. A couple of other units that carried on transplanting, unfortunately, had some disasters with the recently transplanted patients. So essentially, kidney transplantation more or less came to a halt, apart from a few units that were not hit very hard with coronavirus. So over the past sort of 3 months or so, there has been a handful of very urgent transplants, for example, heart and liver transplantation been going on, but on the whole, it's been stopped. But we're trying to get things moving again, and we're actually working very hard to get things moving. So, for example, in London, we are taking some transplantation out of the NHS and into the independent sector, just to get areas, what we call green areas, which are COVID-free. So we really need to get going as soon as possible, and that's our plans at the moment.
Working through those sort of waiting lists that they're talking about in the press.
Yes.
That's fantastic. So Jeremy, we touched on this, and obviously we spoke during the week, and the legislation being changed, that obviously has made this all the more pertinent to talk about this. And a lot of the questions that people are asking, so this may seem like a very basic question, but if they don't opt out of, the change came when you're automatically opted in to the organ donation program. Is that correct?
So the change is what we call an opt-out. And what that means is that when someone dies, it is presumed that they have consented for their organs to be used for transplantation. So there is a big difference, but I think there's also a lot of misconception around what that actually means. And so, for example, where I live in Northwest London, we have these WhatsApp groups, I'm sure you have in your areas.
Yeah.
And there's a lot of utter nonsense promulgating around these groups about quickly opt out before the government has hold of your organs, all this sort of nonsense. It just doesn't work like that at all. What it means is that we're trying as a country to increase the amount of organs available for transplantation, because there's a big waiting list, and each day and each year people are dying for want of organs. So anything that we can do as a country needs to be done, because it sort of strikes at home when you know someone waiting for a transplant, or whether you're actually within the field. But we need to increase the amount of transplantation that occurs, and this is one way of doing it.
So typically, just to give us perspective on those numbers, do you know, sort of roughly speaking, how many people are now on that list waiting for a transplant?
Well, between sort of 5,000 and 8,000, but of course there's lots of different organs on there. So the biggest waiting list actually for solid organ transplants is the kidney transplant list, which is about 4,000 people waiting. And so what we say is roughly about 400 people a year die from not having the organ that they need. Although that figure is actually increased, because if someone's waiting for an organ, they have to be fit enough to survive the operation for the transplant.
Yeah.
As time rolls on and they haven't got that transplant yet, sometimes they're suspended or taken off the list. So, and therefore their chance of getting a transplant is then gone. So we say that roughly 400 people die per year, but it's actually more than that. So the need for more transplants to be taking place is massive.
So that obviously focuses on the patient that's waiting for the transplant, and their condition may deteriorate whilst waiting. But talk to us about the actual person giving the transplant, so the donor themselves. I'm presuming there's a certain level of fitness that they have to be. And one of the questions that the rabbi and I were discussing during the week was, is there effectively an age after which your donors don't become worth anything to the donor system?
So that's a really good question, David. So I would say when I started in transplantation about 10, 15...
No pressure, but mum and dad have tuned in, okay?
But my best behaviour now. So 10 or 15 years ago, I think your point was a bit more pertinent.
Oh, it's disappeared.
Sorry, one sec.
Oh, there you go. I've got you back in.
In the fact that we often, from patients that have died, what we call deceased donors, we took the very good quality organs. But as time has moved on, and our knowledge of transplantation and the immunology, etc., has improved, and there is an increased number of patients waiting, we've taken more and more organs from patients that we wouldn't have taken from before, what we call extended criteria donors. So in actual fact, there are certain conditions that are absolute. If someone dies and they have certain cancers and certain conditions, we will not take those organs. But we are taking organs with quite good long-term outcomes from patients that are in their 70s and 80s. So actually, more people than you think can give a successful organ. So it might not be they can give their heart and their lungs, but they can certainly give their liver and their kidneys, for example.
That's amazing. That's amazing, and there's a lot of sort of general medical ignorance around this particular subject. Now, I believe your organization, the Jewish Organ Donation Association, they did a a survey. I think it was back maybe in was it 2019, where you went out there to the Jewish public and you asked them whether they were sort of aware of the halacha surrounding organ donation, and there seemed to be a general fogginess. The fact that a lot of people weren't sure exactly where Jewish law stood when it came to our obligations as regards Jews and fulfilling perhaps one of the most important mitzvahs.
Absolutely. I mean, there's a lot of misconceptions out there, and there's also people that don't really understand, and in fact have probably never thought about it before. So it's actually events like you're putting on this evening are so important for people to talk about. And the most important take-home message from this evening and from all discussions on this issue is the fact that you should tell your family what your wishes are. They're the most important people. And the reason for that is because what people think is they think that if it's an opt-out system and they die, then suddenly the government or the hospitals have ownership of their organs and they will just use them in any way they wish. That is certainly not the case. In every case, in the unfortunate event that someone, for example, is on intensive care and is brainstem dead or about to die, the families will always be involved in these very difficult discussions. The family will always be involved. And if you have told your family, if one has told their family what they want, it's going to make things so much easier at that difficult time. So the most important thing is to share your wishes and tell your family and friends what your wishes are.
And so even if there is that sort of that automatic opt-in, that discussion still happens between surgeons. Yeah,
absolutely. It absolutely still happens. Now, we haven't actually had a case in the UK yet of where someone has died and could be an organ donor and their relatives haven't been found, and the very difficult and thorny issue of whether that we should use their organs has come up yet. That hasn't actually happened yet.
So it's always with full consent and the knowledge of the family.
Absolutely. Okay. But what we have found, Dave, and this is a really important point, apart from the most amazing sort of mitzvah of Pikuach Nefesh that organ donation is, research shows that when someone is an organ donor and gives their organs after death, the family get a lot of comfort from that. And the grieving process is actually alleviated somewhat because of such an enormous and amazing gift that the person has bestowed upon people that were suffering, who now have the gift of life from them. So out of that absolute tragedy springs hope, and that's why, in a way, being a transplant surgeon is amazing, because every time I transplant a kidney or a pancreas, it's come out of tragedy, and that tragedy then goes forward and becomes hope and light for people that have been suffering for so long, waiting for that precious organ.
Thank you for that, Jeremy. One of the things that you mentioned over there was you mentioned brain stem death, and this is one of those definitions that needs to be explained a little bit more clearly, because the debate between sort of the medicine, if you like, and halacha is that there are two different interpretations of when a body has died. So what's the medical definition of it, and how in your mind does that differ from what is often contemplated by the Rabbonim?
Okay, so that's a difficult question. I'll try and explain it as clearly as I can. So there are two types of death. There's brainstem death and there's circulatory death. So you can be a DCD, which is a donor after circulatory death, or a DBD, a donation after brainstem death. Brainstem death is where there's been a catastrophic incident in the brain, whether it's a massive stroke or a bleed, and the brain is no longer sending signals to the body. There's just no connection whatsoever. And the only reason that the patient is, we say, alive in inverted commas, is because they're on a ventilator. And essentially there are certain tests that the doctors perform to demonstrate that there's absolutely no brain activity whatsoever. And that's what we call brainstem death. And what happens in that situation, and this might be a little bit macabre, and it's very, very exclusive to transplant surgery. Not many actual doctors really understand this, but essentially what happens in that situation is that the patient, the person that's died, is taken to the operating theatre in a very controlled way This is what we call a retrieval process. We take those organs in a very controlled way. And those organs actually, in long-term outcomes, do slightly better than those patients that die after circulatory death. And what happens in circulatory death is that the patient's normally on intensive care unit, and they have a load of drugs that are sort of keeping their heart and lungs going, although there is absolutely no hope whatsoever of life. And what happens in that situation is that the patient is taken to the anaesthetic room in the operating theatre, and all treatment is withdrawn. And they very quickly pass away, often along with their family that are there. And then once they're passed away, there's a stand down time of a few minutes, and the patient is whisked straight into the operating theatre, and we try and get down to the blood vessels to get cold preservation fluid into the organ as soon as possible. And because of that difference in the way that we do that, they are considered to be slightly less good quality organs. Although as time has gone on, the disparity between the organs that we take after brain death compared with circulatory death has actually come close together. So actually in the long term, those two types of donors have still both got very successful outcomes.
And so at the Jewish Organ Donation Association, obviously this must be an anxiety, if you like, between the two different interpretations. Do you feel that they're at odds when it comes to halachic interpretations? Well,
I think the halacha surrounding organ donation is very, very complex. And Rabbi Eisenberg, I'm sure, will elucidate that shortly. He's probably sick of me talking too much, but
you keep going. It makes my job easier.
Yeah, no, well, I will do. So there's a lot of issues. However, on the whole, there are misconceptions, in my opinion. I'm giving my opinion. Remember, I'm not a rabbi. I'm not, a halakha expert, but I'm giving my opinion as a surgeon. Is that, for example, we say, well, we have to go to the grave and be buried whole. Personally, I feel that's a nonsense for many reasons. So, for example, people have these ideas in their mind until it's challenged, and they talk about it and realize that actually in Jewish law, that might not be the case at all. And there's lots of little nuances like that about death, whether it be brainstem or circulatory death, that are circulating around. And we need to break down these barriers to get some real clear guidelines and protocol from the rabbinate so we understand. And even if on the basis of those discussions, a person decides to opt out, at least it'll be on the basis of facts rather than opinion, which might not be correct.
Okay, that's very important. So that actually echoes some of the questions we're getting here from Jane. Hello, Jane. Tell your family, sure, but given the automatic opt-in, surely it's safer to register your opt-out if you don't wish to donate. I'm presuming, Jeremy, your advice would be, if you are opting out, have the discussion with your family so that they then know the basis for that decision.
I think. Listen, I mean, obviously, I'm very biased because it's my job. But I wouldn't like to see anyone opting out. But if you have made a decision to opt out, and of course, it's everyone's prerogative. Once you've opted out, that's it. Your organs will stay with you. But of course, as always, it's always important to discuss it with your family. So in the event that someone dies and they're eligible to be an organ donor, then everyone knows, and it's transparent and it's clear, and there's no controversy or confusion. Having these discussions is so important.
And do you feel that, and again, it's hard for you to answer this because you're an insider in more than one sense here, but do you feel that we as a community, as a Jewish community, we are any worse or better at having those kind of discussions with our family than the general populace, or is it a common thing that people in general avoid having unpleasant talks with their family?
I think as a community, and particularly taken on the basis of that questionnaire that JODA, the Organ Donation Association, put out, I think that we are, particularly within that umbrella of people called BAME, so Black and Asian minority and ethnic communities, we are potentially more willing to give. Now, this is a big issue in this country. So in terms of the proportion of sort of Black and Asian communities within the transplant waiting list, because of diseases such as hypertension, diabetes, and the amount of those communities that are actually given the organs is a real disparity, and it's a problem. And I suppose we come under that umbrella. And so for us, and this is, as I say, these are my personal opinions. For us, it's very much a principle, because we make up a tiny proportion of the population. So actually, if we all said, right, we're going to be organ donors, are we going to make a massive difference? Not really. However, we are very willing to receive an organ. Okay, and I think it's very uncomfortable for me, with any community, to be able to take and receive an organ but not be willing to give. And I think it's the biggest Kiddush Hashem that we can as a community to say that we are a community that is very willing to give our organs and go into the UK transplant list to be given to the rest of the population. From my perspective, is extremely important.
We're getting some more comments in. Danny Shintags asked a question. One of the main arguments against DBD is what he calls freak occurrences of sudden revival from a deep coma. How frequently does this actually happen, if ever? Okay,
so everyone's heard something from somewhere from someone else. Okay, as far as I'm aware, after testing for brainstem death, which is a very stringent set of medical tests performed by 2 senior consultants, I have never heard of anybody suddenly coming alive or recovering from brainstem death. I've never ever heard of it.
So it's that rare.
I think it's rarer than rare. I don't think it happens. I think when someone is diagnosed as brainstem dead with these stringent tests, which are complex and they're performed by senior intensivists, no, it doesn't happen. There's no freak things that might happen. No.
Okay. Phil Cohen's written, can you talk about the mental capacity of a potential donor, how that fits into this conversation? I'm presuming as well that we've not sort of tackled the issue of another kind of donor. We're assuming that the person's not going to have mental capacity at the time. They may be already in a coma and therefore at the end of their life. But there are people that choose to give organs whilst they're, so for instance, a kidney is it's a gift that you can give whilst maintaining a healthy life thereafter, isn't it?
Yeah. So I'll try and answer those. There's 2 points there. But firstly, about mental capacity that Phil Cohen has asked. So there are excluded groups from the opt-out. And one of those groups are people that don't have mental, so they're under 18s, and there are people that don't have the mental capacity to be able to give consent, whether in or whether out. So if there's no mental capacity, then those people, it'll probably come down to family discussions at the time of death. Okay. That's the other point you said about live donation. Live donation is on the increase. So more and more people are giving, for example, a kidney to a loved one, whether it be a relative or a friend. It's an excellent way of someone to receive a kidney. Live donors go through such a process of being worked up to be able to give a kidney to make us believe that they're going to lead a long and healthy life, that actually, if you look at age and sex match controls with longitudinal studies, you'll find that the people that would give a kidney live longer than the rest of the population. And that's probably due to them being screened so stringently. So yes, a live donation is the most fantastic gift of life that you could do. However, I do believe from a halacha point of view, this is much less troublesome.
For obvious reasons. And so when it comes to mental capacity, Elliot Simon asks another question, which again we touched on before. If the family have to be consulted before organs can be taken, what is the difference now with the automatic opt-in? So you've said that those tough conversations are having to take place, but you've not yet come across a case where they can't track the family down. So presumably these conversations with families are happening on a pretty much daily basis.
Yes, so that's a really good question. Okay, so first of all, these conversations are had with what we call specialist nurses for organ donation, and they're used to these really thorny, difficult, emotional times, and they approach the family in the most sensitive and the most professional way. Okay, so that's one thing. The other bit of that question is very, very good in the fact that, for example, in Spain, there's an opt-out in Spain, and they have very, very high rates of deceased organ donation, very high rates. But it didn't happen straight away. So when their opt-out came into being, I think it was about 30 or so years ago, maybe more, it wasn't straight away that the amount of organs suddenly increased in quantity. It was about education, it was about knowledge, it was about those conversations that we talked about. So the reality is, changing from an opt-in to an opt-out, in essence, as that gentleman just asked, there's not a huge difference. But suddenly we're having these conversations, we're educating ourselves, we're educating our relatives and friends. And from that basis, I think the numbers will slowly start rising in terms of, as I say, the quantity of organs. But I think it'll take maybe a decade or so. But if it's on the increase, then we know we've done the right thing by bringing in this opt-out.
Fantastic. Steve Wolf has written in, and he's asked a question which is already we addressed right at the beginning, but for people that maybe didn't catch it, again, he's asked, how do you assess whether an organ is healthy, and is there an age limit? I know you did touch on it earlier. Can you just give a quick catch up for people that missed that?
Okay, so that's a very good question. Right. So so what happens is this is the way it works. So for example, say Mr. X is on intensive care unit in Liverpool, for example, and they're eligible to be an organ donor. What happens is all those characteristics of that person, their age, their sex, where they are in the country, their blood group, their tissue typing, etc., all go into a computer, okay? And then one person comes out of the hat. And this computer is with National Health Service Blood and Transplant based in Bristol. And that person might be Mrs. Y, and they live in Ealing, West London, and that's in my patch. So as it happens, I work at the Hampstead Hospital. We have the biggest waiting list in the country. We one of the biggest transplant units, with the busiest transplant unit in the country. And so that Mrs. Y then comes to our hospital, right? But in the meantime, we have a discussion between myself, the transplant surgeon, and the consultant transplant physician. Do we think this organ is good to use for this patient? And these are quite difficult decisions, and sometimes it's marginal, and there's lots of things to take into account. How long the person has been waiting, how well that recipient is, all the what we call comorbidity, other diseases that are going on. Once we decide to take the organ and it's good enough, it comes to our unit. And what we do then is we do something called benching. I don't mean benching like Birchas Hamazon. Benching means bench work. Okay, and what we do is we operate on the organ, whether it be a pancreas, whether it be a kidney, and we examine the organ to make sure that it's good enough. So sometimes on paper, the organ sounds great. This will be a great match for our recipient. And then you look at it and it's just not good enough. Sometimes you find maybe a tumor or a cancer on the kidney. Sometimes you find that the blood vessels aren't good enough, poor quality blood vessels. Or sometimes you find, for example, there's been damage during the retrieval process. So for example, pancreas transplantation, which is a very rare form of transplant, the organ has got to be pretty perfect for it to be transplantable. So at that point then, you say, right, once you've done the bench work, you say, right, we're good to go. And that is when the transplant happens.
But I'm presuming that, therefore, the technicalities of it means that very often the person who's due to receive the transplant is already prepped for surgery, and sometimes you might have to sort of call it off at the last minute.
Happens very, very often. It's just the nature of transplantation, but we explain that to patients. And the other thing, going back to what I talked about before, which is donation after circulatory death. So as I said to you, in that situation, the patient, the organ donor is unstable, and they're taken to the anaesthetic room, and all the drugs are stopped to see what would happen. And normally the patient dies very quickly, and then, as I say, there's a stand down period and they're whisked into the operating theatre. Sometimes that doesn't happen. And I would say about 50% of the time that doesn't happen. So if a patient, a potential recipient, comes into the transplant unit for a transplant, and we know that the donor is from someone that is dying from circulatory death, we say, well, actually, there's a high chance this might not happen. This is like a dry run for you. And sometimes the patient might come in 3 or 4 times before the transplant happens. And that's part of the complexity and the nature of transplant surgery.
So I'm presuming, therefore, that there's the disappointment and devastation has to be they have to go through that every time that there's people, and sometimes very, very often that's repeated.
Absolutely. So yes, it's hard being on a waiting list. However, I suppose there are silver linings, and if a patient has been brought in for a transplant, it shows that they're in a way, they're getting towards the top of the list. And the transplant list is a bit like halfway between a lottery and a waiting list. So the longer you wait, you accrue a certain amount of points. It's a point system. So actually, if a patient comes in, more often than not, they'll get called in relatively soon thereafter. Not always, but mostly. So I say to patients, keep positive, keep strong. Your turn will come soon.
Right, so forgive me, Rabbi, we've left you there all quiet, but we're going to deal with the halachic issues very soon. But whilst we've got so many people engaged, and again, this is one of the questions that I asked you, Jeremy, during the week, is how do we as a community, how do we engage people better in this discussion? How do we raise awareness around organ donations? There are currently 96 people watching this. And I'm presuming they're not tuned in to see me, so they're very interested in hearing what you've got to say. And some of the questions that are coming in means that this is something which we still need to provide a lot of information for. Kate has asked, she comments that the form was very easy to fill out, a bit too easy. How does she know that someone hasn't forged her form? Is it really that easy to fill one of these in? And what happens with them once you fill it in?
Well, well, that's a very good question. I think it's beyond my my pay grade, that one. Okay. Yes, I'm sure maybe someone could forge an organ donor form, whether they would or not, I don't know. It's a good point, and maybe I'll take it back to my my colleagues at NHSBT and ask them. So it's not a bad question. I've never thought of that before.
That'd be great. Ralph Donner, good evening, Ralph. So will medical teams, will they follow the family views and decisions on end-of-life issues, whether or not a lasting power of attorney is in place? Now, Ralph, by background, is a solicitor, so I think that's coming through in his question.
Okay, so the very clear answer to this, and everyone should hear this really loud and clear, is that the family discussion is paramount and their decision is final. So those family discussions will take place, and that will inform what then happens to the deceased person's organs. Those family discussions are central to making decisions whether someone is going to be an organ donor or not. And I wouldn't want anyone to think that their their decisions and their wishes will not be taken into account, because they certainly will.
Stephen has asked us, what happens to the organ if it isn't suitable for transplant once it's been taken? I suppose this is particularly important from a Jewish perspective, and the rabbi is going to talk about how we have to observe a certain sanctity for a dead body and its burial. But what happens to the organs?
Okay, so it's a very interesting question. What would probably happen? Say, for example, a kidney came to my unit and I'm in the operating theatre, I'm looking at it, I think, actually, this is not good enough for transplantation. What it might mean, the nuance could mean that it's not good enough for my recipient that I have in the hospital waiting for the transplant, but it might be good enough for another recipient elsewhere. So another recipient elsewhere might want to take a less good quality organ because they're more in desperation than my recipient. So there's often very good communication between the different transplant units. So there's 5 pancreas transplant units in the country, and there's many more kidney transplant units. We have great communication, and we talk. If ultimately the organ is not good enough for transplantation, then usually it goes to research. And right. That's why we're getting better at transplantation, because of the research that goes on.
And I'm sure that over time, research saves as many people as the actual transplant does as well.
Absolutely.
Robert Nathan, good evening, Robert. He's asked, are there any organs that halacha does not allow donating? I guess this is a question for either of you.
This is not a question for Rabbi Crane. It's certainly for Rabbi Eisenberg.
All right, we're still in there. We're still not asking all the questions of the doctor. I think should we finish asking all the questions?
Do you want to go through that as well?
Okay. Or do you want to swap over now?
Sheila has asked us whether or not, if you wanted to opt out, could you do that online? How easy is it?
I think it's relatively straightforward.
Okay. So you can look that up on the NHS.
Danny had an answer here for Kate, by the way.
Sorry?
Danny Shintag had an answer for Kate over here on the chat.
Oh yeah, let's bring that up. Danny said, typically, if you receive a paper organ donor card and certificate in the post to confirm your registration, if you haven't registered, you can always notify the NHS. And Jeremy, in terms of people wanting to donate as a live donor, do they need to put themselves forward in a particular way? Is there anything that they should be doing, or does that discussion rest until you find unfortunately somebody that you're related to, or a loved one or a relative or a friend that you wish to donate to? How does that happen?
So this, I mean, this is not a rabbinic discussion. This is just a very thorny discussion across the whole of the transplant community. Because of social media, people are putting out adverts, I need a kidney and this blood group, who can help? And people do come forward. But the straightforward answer is, if someone needs a transplant and it's usually a kidney, then yes, reaching out to friends, relatives. And so really, as long as there's no coercion involved and there's no money transaction involved, then anyone really, for the goodness of their heart, can give another person an organ. And I suppose that if you heard of someone in your shul or someone in the community that needs an organ, you feel like, actually, I don't mind giving one of my kidneys, then you can put yourself forward and you sort of make introduction to the individual that needs an organ, and you can talk it through. And as I say, as long as there's no coercion, there's no money involved, then that can take place.
Okay. Rachel has asked, can she say no to research, i.e. the organs being used for research, and yes for a donation?
Yes, if I'm not mistaken, there are parts of the form where there's some free text where you can put your comments in. And if you want to put something like that, that's absolutely fine.
Okie doke. Anthony's joined us this evening. He's asking, what percentage of transplants are successful? I suppose it's a very generalized question, Jeremy, hard to break it down.
So I'll break it down for you in terms of which organs. So kidney transplantation, which is the most common solid organ transplant, I would say at 1 year, the success rates are about in the 90s, sort of mid 90%, to 95, 96%. After 2 years, maybe late 80%. After 5 years, 70 something percent. So actually, these results are excellent, and they've improved dramatically over the past sort of couple of decades. I think the UK, I don't know if there's any international listeners, but the UK is probably leading when it comes to outcome after organ transplantation.
Really?
Yeah, absolutely. I mean, way up there. Pancreas transplant, again, 90 something percent after a year, 70 something percent after 5 years. So actually the outcomes are brilliant, really brilliant.
And I'm presuming that once somebody's received a transplant, they have to have a number of different medications to stop their immune system rejecting the organ. So do they then become more susceptible to disease throughout their life, or does that tail off at some point?
No, it's a very good point. So what you're talking about is the anti-rejection drugs or the immunosuppressants that patients take. So yes, there are risks and complications of those drugs, but the drugs for each patient is tailored to a point whereby the organ is accepted by the recipient, but the side effects of the drug is kept to a minimum. So yes, there is an increased chance, for example, of certain cancers like skin cancer, etc. And these risks are much higher than the general population, but overall, they're still low. So yes, there is that element of risk, but it's a much lower risk than moving on with life without that precious organ.
Mendy Lent joins us live from Nottingham, where he's a student rabbi there. Mendy's given us a bit of a stranger question, but still, given the huge waiting list and the tremendous cost of dialysis, would it not make sense for the NHS to compensate people for donating a kidney? It could be regulated to ensure people weren't being taken advantage of. That'd be one marketplace I wouldn't want to have a job regulating.
First of all, good evening, Mendy. I hope you're well. it's actually a very, very good point, because dialysis, which is the alternative to kidney transplantation, although it's extremely effective and very successful, it's also exceptionally expensive. So in the long term, giving someone a kidney transplant is much cheaper in the long term, which is why, in a way, the government are pushing for this. So from a health economic perspective, it's much better than keeping people on dialysis. However, when it comes to money and being compensated, where do you stop? That's a very difficult issue. Although I think there is some merit potentially in looking into that, because getting people off dialysis is our aim.
It's an expensive business, right? Steve Wolf has commented, and again, we did touch on this at the beginning, but how has COVID-19 affected the transplant waiting list? If you could just touch on that again, please.
Yeah, so Steve, that's a good question. So what's interesting, so in terms of the transplant waiting list itself, I can assure you numbers are swelling, because there are a lot of transplants that we haven't been able to do. So those patients are waiting. And every month, and I don't know the exact numbers, more people are being added onto the waiting list. So the waiting list is expanding for those two reasons. So once we need to get back to transplantation, and we're trying our hardest, because once we get back full steam, it's going to be exceptionally busy, I think. So the answer is the transplant waiting list is increasing in size.
And I guess this will give us the sort of final overview on it, Jeremy, and we'll let you get on with whatever it is you do on a Sunday night when you're not talking to us, which I'm sure is more important. But Elliot Smith has asked, what's life like for a kidney patient if they don't have a transplant? In what ways will the patient's life change? I suppose that is, because we take it for granted we're going to give them a new lease of life, but the day-to-day struggle that they have with dialysis and everything else, how does that change?
Okay, so that's a really good question, Elliot. Thank you. Look, not everybody is eligible for a transplant. There are some patients who actually, they're on dialysis, they go to their unit 3 times a week, and it works well for them, and they're relatively healthy on dialysis. And even though we know that the long-term quality and quantity of life is better with that organ transplant rather than being on dialysis, some people opt for just remaining on dialysis, because there are complications and risks involved with any operation, and particularly a transplant. So yes, sometimes there are disasters. We've had, this is a vascular operation, a transplant, and sometimes patients can have catastrophic events. So yes, it's not straightforward. It's not a walk in the park. However, when we work up a patient for a transplant, they're worked up in a multidisciplinary way. So physicians and surgeons check out that patient to a point where we know exactly, and we try to work out what all eventualities would be if this patient undertakes this major operation to have a transplant. So we try and rule out any complications that we can foresee. So the answer is remaining on dialysis for them. And I talk about dialysis and kidney transplant because it is the commonest solid organ transplant out there, the most common that we do across the world. So having a successful kidney transplant is much, much better than remaining on dialysis, although not for everybody. And there are a huge cohort of patients, of course, that can't have a transplant, whether it's an immunological barrier or they're just too frail and they've got too much what we call comorbidity, other disease processes going on. So a transplant isn't for everybody.
I understand. Right, last medical question, and I promise we're going to let you go.
Don't worry.
Clive has asked something which I'm sure people have thought about. Can you take an organ from somebody who has died from COVID? I'm sure there must have been a few that were on the transplant list.
So, Clive, it's a good question. In essence, the answer is no. In essence, if COVID becomes that prevalent within our population that we have to take into account there's going to be a huge proportion of organs that are going to have a COVID virus within them, then I think we need to do a lot of research to work out whether there is a safety aspect that we might be able to overcome. There was a case report from China, okay, I'm talking China here, that said that they transplanted a lung transplant from a patient with COVID that died from COVID from China. Right. So it's potentially being done, but on the whole, the answer is no.
Right, okay. Jeremy, there's been lots and lots of questions for you. I think people are very fascinated by the subject. Obviously, the Jewish Organ Donation Association are doing some fantastic work. And I know that you on a day-to-day basis are doing and your colleagues in the NHS are doing a fantastic job. We'd like to thank you for the time that you've given us this evening in informing this discussion, but also all the work that you do on a day-to-day basis in saving lives. Thanks for joining us.
It's my pleasure. Can I say before I go, it's these sort of evenings that start those discussions with families, which I say is of paramount importance. So well done. I'm going to stay on. I'm looking forward to hearing what Rabbi Eisenberg has to say.
No problem. No problem.
Jeremy. Thank you.
Okay, Jeremy, I'm gonna put you back in the waiting room so you can have a drink whilst you're watching this.
Whiskey, actually.
Yeah, go for it. L'chaim. Oh, and Mazel Tov in advance. I believe your son's got his bar mitzvah.
Yes, my son's bar mitzvah, Daniel, in a couple of weeks. Thank you very much.
Mazel Tov. Mazel Tov.
Thank you so much.
How are you going to be celebrating that? That'd be an interesting question. Are you going to? Is there any shul or any celebration? How are they allowing things in London?
I think it's going to be a virtual Zoom bar mitzvah, unfortunately.
Yeah, we've had those also. I had one this week. Yeah.
I think they tend to be slightly cheaper than a normal bar mitzvah, Jeremy. If that's any consolation.
There are silver linings.
Okay, Mazel Tov to you and the rest of the family.
Thank you so much. Thank you. Thank you for coming in. Thank you.
Rabbi.
Hi, David.
Okay, so over to you on the halacha, but just to sort of get the discussion going, I'm going to just go back to some of the comments that have been listed that are perhaps more pertinent to you than they were for Jeremy. Sue has written in, for many years, Brian and I had a disagreement about organ donation. He was against it halachically, and I was for it for the following reason. During Victoria's lifetime and ill health, there were always the possibility that she was going to need an organ transplant of liver and possibly lungs. My argument was, how can we possibly accept organ donations for Victoria, which we would have done, and not make ours available to save life? This is one of the things that is central to this discussion.
It is, but I think there's a very important point that needs to be made. So I was doing research today about this as well, and I had conversations with a few experts about it. And one of the main points that I would make is that if in halacha it is not allowed, then as great as that, emotional argument is, it's still not a reason to do something that's against halacha. And I have not said that it is not allowed in halacha. Please don't quote me as having said that. What I'm trying to say is that an emotional argument such as that is not enough of a reason for us to say, and therefore the halacha has to be. We're going to have a discussion. There are going to be a lot of questions. Hopefully they're going to come up now. And as Jeremy said before, it's an extremely complicated discussion in halacha. I called up Dan Gelly today to speak about it because I know you told me about the conversation that he had. In London.
I think Gary Hirschkovitz had picked up on a conversation I think that Dan Gelly was a part of, very similar to this, but I think it was perhaps even South Hampstead Synagogue, somewhere like that. So you spoke to Dan Gelly today.
I spoke to Dan Gelly personally today about it, and he said to me, "Look, you called me on a moment. I don't, in 10 minutes I can't teach you everything. It's just." I said, "No, I know a lot of the bits and pieces." So we went through some of it, but I think the first thing to be said before we get into the halachic aspects is that halacha is governed by, just as science is governed by strict guidelines, so too is halacha governed by strict guidelines that should go above and beyond what our emotions tell us. There'll be answers to everything as well, and in the halacha as well. But just to say that, well, how can we give and not? How can we take and not give? Therefore, it must be permitted in halacha to give an organ is not really a correct argument in halacha. We will get to the arguments in halacha and we'll say that in general probably it will be permitted. However, that's not going to be the reason why it will be permitted.
But as on the most basic terms, given the fact that the halacha and Judaism as a whole tends to sort of take the view that saving one life is akin to saving the whole world, surely there's no question when it comes to organ donation, it is allowed. Right,
so the halacha bottom line is, yes, it is allowed. However, what I will say is also, and this goes back to a tshuva that comes up in the Ridvaz or the Radvaz, which from the 1600s. And basically the question was asked, a horrible question to have to be asked, but basically what happened was 2 people were kidnapped. And one of the people was told, if we call them A and B, if we allow with A, we will cut off your hand. And if we chop off your arm, you allow us to chop off your arm, we will allow B to stay alive. if you don't allow us to chop off your arm, we will kill B. Is A obligated to allow his arm to be chopped off in order for B to stay alive? And the answer is no, he is not obligated. Of course, it's a mitzvah if he were to do so, but he's not obligated to do that. And this is one of the first sources that they would cite for organ donation, saying, yes, it's a mitzvah, but to turn around and say, because it's a mitzvah, therefore everybody has to do it. People are there. I would say the following. There are many, many, many mitzvahs to be grabbed over the next 120 years of your life that you don't have to start making this big fuss about the one mitzvah you're going to do after you die. You know what? You can keep people alive now. You can do so many great things. So I find that the organ donation, whilst it's extremely important, becomes a little bit of a red herring in a discussion that's a much bigger and greater discussion of what are you going to do in your lifetime to ensure people have longer lives? Maybe you can visit somebody who is lonely. We say loneliness is a killer. Maybe you can help somebody who's depressed. Depression is a killer. So you say, yeah, but I'm giving my kidneys and my lungs after I die. Wonderful. But why not do something when you're alive? That counts so much more in God's eyes when I have time and I give it away, rather than I say, well, I'm dead anyway, take my organs.
But one doesn't negate the other. I mean, you can do both.
Don't.
You can do both.
Absolutely. And that's why I started off the answer that I gave to you before, is that giving organs, we're going to say, yes, it is permitted to give organs, right? However, even if we say it is permitted to give organs, I think that the discussion about giving life and the discussion about Pikuach Nefesh, that everybody touts the words Pikuach Nefesh, it is so much of a wider discussion, and it has so many more ramifications other than this one ramification. And we need to be discussing all the ramifications rather than zooming in, or according to Mr. Crane, he says we're not even zooming in on that one either, which is probably also correct. We should be zooming in on so many ways of our abilities to be able to save people, not just post our death.
There's a little bit of a discussion that's happened in the comments between Rodney Barkley, who said that he has a Halachic organ donation card which says not for research.
Right.
And Gary, good evening, Gary. Hi,
Gary.
Rodney. Surely, so he writes back to Rodney. Surely, even if it's used for research, it ultimately ends up saving a life. Is it not the same directly or indirectly? Does it not account for the same thing?
Right. So in halacha, really, that the mitzvah of giving, if you're saying it is pikuach nefesh is defined as saving someone's life, not potentially saving someone's life. So if, as Mr. Crane said before, there's a massive waiting list, and I don't know what the chances are of people who die of their organs being usable, but my guess is that they've done all the tests beforehand, as he said, and so you could probably use the organs if you're on the list. So that would be the Pikuach Nefesh. There would say, yes, it's a mitzvah to give an organ because you're actively saving somebody's life. The halacha is a lot more shady and a lot more gray about that, and saying that I will donate my body to research so that they can therefore in the future save somebody else's life. That's sort of a lot more questionable. In general, the halachic opinion seems to be that, yes, while Gary is right, that the only way we're going to be able to figure out how to do better transplants is by using organs from people and doing research on them, that does not fit the category in halacha of Pikuach Nefesh that would allow you to give. But again, as Rodney said, so fine. So you have an halachic organ donation card that says for donation only and not for research. And even with the NHS, it's the same thing. It seems Jeremy said that also works.
Yeah, you can specify that. Rachel has asked, and again, this is just a bit more from the perspective of when does a mitzvah count and when doesn't it? But if mitzvahs are about our neshama and its ascension to a higher level, does it even count once we are dead? I know.
So that's an interesting discussion. So there are those people that say, that's not a mitzvah. You're dead, finished, done, not a mitzvah, right? Others will say, well, no, if I leave behind something, so let's give you the most basic example, which we discussed last week, which is Kaddish. If I leave behind a descendant, and that descendant says Kaddish for me after 120 years, so then that is leaving behind someone, and this good that he does allows my neshama to ascend. So if I leave behind my organs and that organ is transplanted in somebody else and that other person does good because of my organ transplant, then it could very well be that the goodness that he has done is also credited to my account. But again, I'm not God's accountant, so I can't vouch for that 100%.
Now that's a great title for a book, God's Accountant. Okay, Edward Gray has written in, I had a card for about 20 years, and when I started to observe my Judaism more seriously, I was told that I should not be a donor, so I deregistered. Now, the halacha on organ donation is something that is still very much being debated and rewritten, if you like, or added to on a daily basis as medicine evolves and as the situation evolves. So I am conscious that the advice given by Rabbonim, say 20 years ago, has very much changed to how it is today. Do you think we've become more, it's more acceptable now in wider?
So that's an interesting question. So I would say, for example, a responsum that I saw from Rav Moshe Feinstein this afternoon said that giving an organ is taking a lot of chances with that person. He gives his own opinion about it, and that might have changed now with medical detail. However, he says the chances of that individual actually living or getting any benefit whatsoever from that organ are minimal. So you're basically, I mean, in those days, as you were saying, you're basically killing the guy, harvesting his organs, and you're giving them to somebody else where they're not going to do any good anyway. And that might be when he wrote the tshuva, when he wrote that response in the 60s or the 70s. I didn't check exactly when he wrote that. That might have been the case. And Jeremy said in the last 20 years, our success rate has massively gone up. And so the discussion now is to say, well, if the same Rabbonim would live nowadays with today's medication and today's medicine, would they still say the same thing? And that's where there is a lot of discussion, a disagreement amongst the Rabbonim, where some will say, no, he actually would have said something different. And others will say this was his opinion and this is how we go.
Okay, well, this is a much more difficult question, but the concept of Yeridas Adoros, so that successive generations of Rabbonim cannot undo the takonos that were put in place, or the opinions that were put in place by previous generations, sometimes is seen as being an obstacle for us solving practical problems in halacha. So, for instance, the debate around the law around agunus has always been that we can't undo what has previously been said. How do you feel that is that changing in this kind of debate as we start to, learn new things? I mean, the medical science is a completely different field to where it was.
So my understanding will be, yes, that it will change. I think aguna is something that goes back, literally back to the Mishnah and back to the Gemara. I think it's important to mention also that the original aguna in the Gemara was actually a woman whose husband disappeared, and we don't know if he died or if he didn't. Not a husband who was recalcitrant and decided to leave his wife behind, which I think we can all agree is an abhorrent thing, and we're trying to find a way around it. But the aguna situation is not, I don't think that's for tonight. That's not a discussion.
No. But I was just using that.
But yeah, that's a good example. So the question of Yeridas Adoros is a big question. So let me just explain what that means. The question of Yeridas Adoros is that we have an idea that the further back you go back to Sinai, they actually had a better understanding, not a worse understanding of the Torah. And so therefore we don't really have the shoulders to turn around and say didn't know what they were talking about and change it around. That might be true. However, when it comes to medication, there's a lot of discussion about it, because you look in the Gemara, and the Gemara has certain things, certain remedies, etc., etc. And we speak about in the Poskim, it's discussed something called Nishtanu HaTavayim, that the Teva, that the nature of people changed, or the nature of how we understand people changed. And therefore, what was okay then is not okay now, and vice versa. I'm in the midst of learning with someone now the halachas of treating an ill person on Shabbos. And there were certain halachas that the Shulchan Aruch right says you can be mechalel Shabbos, you're allowed to desecrate Shabbos for A, B, and C. The Mishnah Berurah then says, well, nowadays we got better medical knowledge, so no, you're not allowed to. So it was in the olden days, if you had toothache, you would be able to be mechalel Shabbos. Today, if you had toothache, you take 2 ibuprofen on Motzei Shabbos, you go to the dentist for emergency, and chances are you'll either be able to have a cavity, or if it's really bad, a root canal. If it's even worse, they'll take out your tooth. But you don't need to be mechalel Shabbos for that. So things have changed, and as we evolve, and as time evolves, and as medication evolves, it means also that the questions change. That the question that was asked of Rav Moshe Feinstein is not the question that's being asked today of Rabbonim. Rav Moshe Feinstein was asked a question: when you have a person who will get a transplant where that transplant is going to be almost useless, what would you say? So Rav Moshe Feinstein gave his answer. But the question that's being asked to Rabbonim nowadays is when you have a transplant where, as Jeremy said before, you have for the first year over 90% success rate, and over 5 years over 70% success rate, that's a very different question than what Rav Moshe is being asked. So to turn around and say, well, Rav Moshe said was forbidden, is misunderstanding the science behind it. And I'm sure that the Rabbonim take that into account as well.
Got some fantastic questions, if you don't mind.
So
I'm going to take two here that are effectively the same, or three actually. So Clive Moss Barclays asks, in halacha, when is a person dead? Mikey Lebret via Rivka. Good evening, Mikey and Rivka. They're doing some fantastic work recently. Absolutely outstanding. Can the rabbi discuss the halachic difference between brainstem death and circulatory death? And again, that has been echoed by Modi in more round terms. Elaine and Richard Burmitz have also asked a fantastic question about the fundamental question about being buried complete. So let's maybe address that last, but let's go into the difference, if you like, in definitions from a halachic point of view.
Okay, so let's start at the beginning. The Gemara in Yuma discusses if you have a person that a building collapsed upon and you want to go start looking for the people that are underneath that building, and you start taking off the rubble. Now you're obligated to take off the rubble because there's a question of Pikuach Nefesh here, and even if it's a question of Shabbos, of Yom Tov, or Yom Kippur, whatever it might be, Pikuach Nefesh says, get moving, don't even ask a shaila, jump on top of that rubble and start getting that person out immediately. Now, if we find that the person has died, the mitzvah goes away, and then you don't continue taking that out. And the Gemara discusses how far or which part of the body needs to be uncovered and which part of the body needs to be seen in order for us to be able to say that the person is actually dead. And this is where the halacha comes from. And the bottom line is that in halacha, most poskim, although I know that there's a disagreement, and Rodney will put it in over here from Robbie Berman, from Hodge, there's a great disagreement about what Rav Moshe Feinstein held. So there are those that say that the halacha was, and always has been that respiratory death is the only death as defined in halacha. Respiratory death will be cessation of breathing. I don't know if that comes with or without cessation of heartbeat. That's not my field. That's something you'd have to ask Jeremy how that works. But that would be one thing. That's the respiratory death. The other death, which has come up recently, is something called brain death. And the idea of brain death in halacha is as follows, meaning you could have somebody whose brain or brain stem is not working anymore, and when the brain stem is not working anymore, the main connection between the brain and the rest of the body has been severed. And so therefore, all the involuntary things that the body does at one point or another will cease. He'll stop breathing, his heart will stop working, etc., etc. So some say as soon as the brain has gone, that means the person is dead. And the reason the person is dead, even though their heart is beating and even though they might be breathing, is it's the machine that's breathing. It's the machine that keeps the heart going. For all intents and purposes, the way it's described in halacha is this man has been decapitated. And in the same way, you wouldn't say, I don't know if anybody's ever seen this, but I've seen it. If you've ever been to a shechita house or seen anybody slaughter chickens, sometimes what will happen, they will shech the chicken and then the chicken will still run around. Yeah. So they run around the chicken. Doesn't mean the chicken isn't alive. But for whatever reason, and again, I can't explain it because I'm not a doctor and I don't know the science behind it, the nervous system keeps twitching and keeps moving, but the animal is dead. Yeah. Right? Similarly, when I've seen shechita, sometimes after 15 seconds, the cow is dead, even though it's braying after they have shechted it. Yeah. So that one does not, it's as if it's been decapitated, and that means, if you chop the head off somebody, there's no chance, even going back to what we said about these freak incidents, there's no such thing as a freak incident of somebody's been decapitated and has come back. So that will be considered death. Others will say, well, no, that's not really death. Death occurs, as the halacha says, with cessation of breathing, etc., etc. because there is that big discussion about when a person is or isn't considered dead, taking a heart which would require the person still being alive, at least you'd need the heart still be at the moment. As things stand, you cannot take a heart. Jeremy, you could correct me if I'm wrong on this one, but as things stand at the moment in science, it is impossible once the heart has stopped beating to take a heart that's not beating and to transplant it into another human being. And therefore, it is necessary to use the definition of brain stem death to be allowed to take that heart from somebody and move it over. There's a very, very big discussion about whether this is allowed in halacha or not. I think it's beyond the scope of tonight, but suffice it to say that Daim Gali told me that even though in Israel the chief rabbinate holds of brain death, they only hold of brain death as far as turning off machines is concerned, but not for transplants. So that there is a misconception about that. And he has a letter from Rabbi Shlomo Amar, who's the former Sephardic chief rabbi, that says so. So that they will, that's the one side of things. The other organs can be taken even after a person's had circulatory death. But as we heard from Jeremy before, that they bring them into the room. If they see there's no chance, they bring them into the room, they cease the treatment, and then as soon as the person dies, they whisk them off to do something. This also in halacha is very questionable, because if you cease treatment, are you now causing somebody to die? So therefore, Dayan Gali said, nowadays, even following circulatory death is not so simple. It has to be done, you really have to know what you're doing in halacha to be able to answer that question. But if that's done correctly with a circulatory death, so then you would be allowed to give organs after that, whichever organs can be harvested after circulatory death.
So really, given the complexity of all these questions, it's a wonder that we don't talk about it more. You literally do not hear about organ donations. We hear about everything else. Any other kind of donations, people are the first people in the world to say they donated. There's matching campaigns. There's all sorts of stuff when we come to tzedakah. But when it comes to organ donations, again, it's one of the greatest things that you could give to somebody. Why is it that we do not talk about it, in your opinion?
So I'm not sure exactly why it is. My guess is that, I was listening to before, even to Robbie Berman on an interview that they did with him on a podcast called Headlines. So if you want to look it up, you can look up Headlines podcast. Is about organ donation cards, whether somebody should or shouldn't sign them, and they have two sides to the disagreement.
And Robert, just for people that don't know,
so let me get that. Dr. Robbie Berman is the head of what's known as HODS, Halachic Organ Donation Society. So the Halachic Organ Donation Society is, they are very into organ donations. They have come out very strongly for organ donation. And what he said is he was doing an article for the Jerusalem Post at one point, and he wanted to know why in Israeli society, and even in Israeli society that was not particularly religious, forget about religious society, even in irreligious society, why is it that people don't give organs? And he tells this story, which is it's actually a funny story, but in a way, like it's a very telling story about what people are, how people are. He says, I went to Emek Rephaim, which is an area in Yerushalayim, and I stood outside the non-kosher Burger King. And out stepped a guy without a kippah, with a tattoo, with a cheeseburger in his hand, munching away. And he says, excuse me, I'm writing an article for the Jerusalem Post. Will you tell me why we cannot give organs? Did you sign an organ donation card? He says, no, I wouldn't sign an organ donation card. Well, why not? So he said, well, it's an Avera. So the guy looked at me and goes, I don't mean to sound like facetious here, but listen, with the tattoo and the cheeseburger and the no yarmulke, it's a bit interesting. He goes, look, after death, something else. So people somehow, that's just the way people are. It's very, you know what I mean? Like people are very funny that way. People don't like, as we said before, people don't like to discuss what's going to happen after they die. It's not the most comfortable discussion to be had. It's also, I guess, not a discussion that people think about so much because it's not something that's on their radar, organ donation. And so therefore because of complexity within halacha about it, people don't really
address
it. But I'm not sure why.
So let me ask you then, as one of your congregants, people assume that when it comes to discussions about what happens after we die, everybody who wants to tidy up their financial affairs and make sure there's no arguments amongst the children will say the best thing you could do is to write a will. So you'll go and speak to a solicitor, or you'll go and speak to somebody that can advise you on those things. How many people come to you as a rabbi and say, Rabbi, I'm planning for what happens when I go, either because they're ill or they're getting to a time in life where that discussion becomes more pertinent? They can come and speak to you about those things.
So interestingly enough, I've only had one individual, I'm not going to name him now, but he knows who he is. I've only had one individual who's come to speak to me about halachic organizations, who sat down, pulled out his halachic organization card and said to me, Rabbi, whether you like it or not, I'm giving my organs. Nobody else has ever asked me the question about organ donation, and it is what it is.
Okay, right. Let's have a look
at that comment of Rodney if you wanted to.
I'm going to. I'll bring that up again. So Rodney's talking about the Halachic Organ Donation Society, and again he says it's supported by some of the most major rabbonim in the world, and you can look at the halacha section on their website www.hods.org.
I had a look today actually. So what I would say is the following. Number one, when I spoke to some of the people, again, Dangeli amongst them, about Hods and specifically about Robbie Berman, they were less than flattering about him, but I'm not going to go into that. There seems to be a lot of discussion about whether they think he's credible or they don't think he's credible with his sources. Having looked through his website, just a cursory glance, he writes, I looked at the website and there was one of the articles in Hebrew, a lengthy article that tells you why you should not donate organs. And I found that extremely strange, but I wonder if people were looking at the website and said, oh, long discussion in Hebrew about donating organs. If you don't know what it says, then you just skim over it and go, wow, look at that. Look, 10 pages on the Halachic Organ Donation Society. When in reality, that thing says don't give organs. I also listened to the interview of Rabbi David Feinstein, who's the son of Rav Moshe Feinstein, and they asked him, what was your father's opinion? And he said, my father's opinion was that cessation of breath is the end of life, which is not what the Halachic Organ Donation Society says. And they kept on pushing and pushing, trying to get the point across, and he just wasn't having it. He says, I said it, and I say it again. Whereas his son-in-law, Rav Moshe Feinstein's son-in-law, Rabbi Moshe Tendler, and his grandson-in-law, Rabbi Mordechai Tendler, say that Rav Moshe is for it. They also asked Rabbi Feinstein on that, should a person sign an halachic organ donation card? And he said, I think my father would have said no. So it's very strange. So if you go at the video section, you have to actually watch the videos to see what the videos say.
Do you think it's a sort of a sad indictment and a comment on the fact that today, as far as major Torah heavyweights are concerned, there are very few people that stand up to the legacy of Feinstein?
Oh, there's almost nobody that today can stand to the legacy of Moshe Feinstein. These questions started up coming in the 50s and the 60s, and they just, when we started being able to do these things, medically, the questions came up in halacha, and there were a few questions. The most expensive, say again, what was that?
Danny's just saying.
That could be, but if you want to do that, then just sign up with the NHS. There's no issue. Plus, you can if your family knows you've got the HUD Society card, even nowadays with the automatic opt-in, your family will know what you want to be done with your organs, and they'll give it. So whilst it might not be legally binding, the HUD's registration cards, it will tell your family exactly what your wishes were.
So going back to the question about Moshe Feinstein, though. What, from a rabbinical point of view, is being done to sort of nurture people that need to really concentrate on some major areas of halacha that in a modern age, as we evolve.
There are institutes of halacha and science, and some of the greatest poskim nowadays do spend a lot of time on science and have written extensively on. So it's not something that happened with Rav Moshe Feinstein and it stopped. So there are major halachic opinions nowadays. Again, will we say, were they as great, or are they as great as Moshe Feinstein? They themselves will tell you that they aren't. But they are what we have at the moment. So, and They know the science as it stands in 2020 as opposed to the science as it stood in 1960. And so their word will have to become sort of binding, considering what it is or what it isn't. The question becomes, as was mentioned before, there are many major rabbonim on the Hod's website. There are many rabbonim on the Hod's website, but there are certain rabbonim that are considered the heavyweights, regardless of affiliation, whether you're Mizrahi, whether you're Haredi, they're considered the heavyweights, and none of those have signed up on the website. And it's a glaring omission that you have some of the greatest rabbonim or the greatest rabbonim in our generation that haven't signed up. So even if you go down tier 1, tier 2, or tier 3, and you find lots of rabbonim in tier 3 that have signed up, if all the top tier people say we actually disagree with this, then I don't know personally if 50 or 100 or 200 tier 3 rabbonim really will give me a halachic imperative to have to change my mind.
Let's go back to one of the questions, if you don't mind, asked by Elaine and Richard Burmitz. Wasn't there a fundamental question about being buried complete? So obviously, this is something that that Misaskim go to some great lengths, and again, the Chevra Kadisha for years have been making sure that we bury our dead with sanctity and with the respect that they deserve. And Halacha is very clear on that as well. So how that would seem to be at odds with burying somebody with a part missing.
Okay, so there are 3 issues that will be, other than the issue of death or not death, there's 3 other issues that come up after death, post-mortem. Number 1, what is known as nibol ames, which is considered disrespecting a dead person, and taking them and chopping them up is considered disrespectful to them. Number 2, which is isser hana, which is considered getting any benefit from a dead person. And lastly, the mitzvah to bury somebody immediately or as soon as you can, as opposed to taking your time. All 3 of these things will be waived in cases of Pikuach Nefesh. So as so many other things will be waived in the case of Pikuach Nefesh, these 3 will also be waived in the case of Pikuach Nefesh. And so therefore, if somebody decides that they want to give their organs, yes, the question is, well, I'm not being buried whole. The answer to that question is yes, but you have your get out over there and saying, I was doing something with Pikuach Nefesh, and therefore it is actually a mitzvah in this instance not to be buried whole.
Okay. Now, there's some difficult questions being asked, and I'm going to get into trouble if I don't ask you difficult questions.
Please.
But, and again, I don't know whether this is something that you want to do or whether you want to give both sides of it. But people are getting a little bit frustrated, perhaps. Bottom line, Rivka Lebret is asking, or Mikey is asking again, bottom line, would you advise your congregants to opt in or opt out, or specify only post-circulatory death or something else? And that then has been echoed. Adam Shogger, have you forgotten Manchester's favourite catchphrase, Mikey? It's Nishso Poshet.
It's not so poshet, Adam. It really isn't.
It really isn't. And again, Modi is asking, can I echo Mikey? What is and what isn't allowed? Please leave the rabbinic politics. I just want a snapshot and a conclusion. Is it too complex to give?
No, so what Deinberger said to me, Deinberger's answer to me about this was as follows. He says, if you want to give an organ, you can give an organ. Is it a mitzvah to give? Yes, it is a mitzvah to give. But he said to me, these were his words, I can think of greater mitzvahs.
Really?
Yeah.
Okay.
I mean, what I would say, maybe echoing that, is if you really want to do something great, how about considering giving a kivli in your lifetime? The question that was asked previously, I can't remember who that, it was Sue Lin who asked the question.
Yeah.
Actually, many people point at the Haredi community and say the Haredi community, they only take and they don't give organs. Actually, the highest per capita of giving kidneys and even giving kidneys to strangers is amongst the Haredi Jews. They have organizations called Matnat Chaim, which means gift of life. They have another organization called Renewal in America, and people, many people have given kidneys to absolute strangers. So if you want to do something really great, there is a really great mitzvah you can do in your lifetime as opposed to waiting till afterwards.
And given the success of these operations, it's
Pardon?
Given the success rates that Jeremy was talking about,
Yes.
it's all the more reason to be doing it whilst you still can.
Oh, absolutely. So
Yeah.
what I would say is anybody who would like to give an organ, by all means, I'm not going to say whether you should or whether you shouldn't. If you feel you'd like to give an organ, yes, it is a mitzvah, and yes, you can give an organ. I feel as a rabbi or the rabbi of my congregation, I shouldn't be telling people whether they should or should not be given organs. This is for themselves to decide whether they feel comfortable with that or not. But if they feel comfortable with it, then there is no halachic barrier to doing that. And whilst Jeremy says being an organ donor can think of a greater, more beautiful mitzvah, I will echo that, except for the fact that I think a living organ donor is a much more beautiful mitzvah than a dead organ donor.
Okay, some fantastic questions from Anthony Jacob. Can we delay burial to harvest a person's organs?
Yeah, so that we said, yes, you can. In the same way, if the organs are being harvested for Pikuach Nefesh, in the same way we said we don't have to bury a person whole, we can also delay burial for that reason, because it's Pikuach Nefesh, so that will definitely take precedence over it.
Okay, a couple of the doctors are commenting. So Jeremy has sort of wants to have the last word, but he says that as a live donor or deceased donor, he thinks that's a fantastic thing to do. Adam Sugar has 2 patients who have done live donations, one to a complete stranger, and again, he says that's a lot for one GP's list, he thinks. So that's fantastic.
I would guess it is, but I don't know. I don't know what the numbers would be like. But again, it's a fantastic thing. But I would go back to what I said originally, and that is there are so many people that are struggling with so many things, and so many things can be put under this umbrella of Pikuach Nefesh beyond organ donation. And so that it doesn't make organ donation unimportant, but it means instead of looking at organ donation only and saying we have this great obligation to donate organs, what we should really be reframing it is we have this great obligation of Pikuach Nefesh. And it means, therefore, we need to look for all avenues that we can to help people and to keep them safe and to keep them alive. And that could be by donating organs, but I think there are so many other ways that we have every single day, week in, week out, to do that. And rather than making only a one-off organ donation and then living your life ignoring everybody, rather than that, maybe make the gift of life after you die. But don't forget to give people the gift of life whilst you're alive. Even if you don't want to give an organ donation, you can still do so many things that keep people alive by just keeping them happy, by just engaging with them, by just making them feel welcome and making them feel part of society.
I can't think of a better note to end on, to be honest. Anybody that's got any more detailed questions, and again, this is a very difficult subject, but they wish to approach the rabbi on it, please do reach out, get in touch through the usual channels. And again, anybody that has medical questions on this, we now have somebody that we can refer to. I'm sure we may be speaking to Jeremy again in the future. Deborah Fraser's with us. She's mentioned bone marrow donation, which again is one of those things that they very often, you see campaigns looking to try and encourage people to come forward who might be potential matches. Adam Sugar mentioned for Rav Hager, who died in April, who ran an organ donation service from Israel and has saved countless lives there and around the world. We have got, let's have a look here. Deborah Eckstein. How can anyone say which mitzvah is greater? Surely it's a great mitzvah if one feels strongly about it and it lives a life full of mitzvahs when they're alive too. I think that's probably the best advice. To live a life of mitzvahs and also to leave a legacy when you're gone.
There is a hierarchy. So a mitzvah that will save somebody else's life can be seen as a greater mitzvah than just putting on tefillin in the morning. It's just that's how God has given us the Torah. That's what God has given us a certain hierarchy within those mitzvahs. So that's right. I don't have a right to say, well, tefillin is greater than this or that. But the bottom line is, a mitzvah, as was said before by Jeremy. So, live donation or after or post-mortem donation, a mitzvah that will save somebody else's life is obviously a mitzvah that is even greater than all the other mitzvahs that you're doing, because you're allowing somebody to stay alive. And Pikuach Nefesh pushes over all other mitzvahs, which is why we say this is such a great mitzvah.
So I guess that then answers directly Modi's question. There must be a reason the rabbi keeps discussing other types of mitzvahs. If it is allowed, then why is it not actively encouraged?
So again, as I said, I can't encourage people to do something that is their own decision. If they ask me, is it a mitzvah? The answer will be yes. But if they ask me, should I do it? I say, look, that's up to you to decide what you're comfortable with. I think it is such a personal thing for the person themselves and for the family that for me to get involved and either to say yes or to say no would be incorrect. I think that, if they ask me what is my halachic opinion, there's no halachic barrier to it if it's done halachically correctly. And is it a mitzvah? The answer is yes. Should I do it? That is something you need to discuss with your family, and you need to make your own decision on. I cannot be the one that makes that decision for you.
Very fair point. Ian Michael Creek, good evening, Mr. President. He has asked, and I know it's not like giving a kidney, but just by being a blood donor, it's such an easy thing to do, and it can also save lives. And I must say, to my shame, I have never taken the time to go and do it. I know people that do, and I think it's an amazing thing, because that is something that is needed every day, and it's the simplest thing, one of the most simple things that you can do with very, very little medical downside risk to the patient. So
when I was in yeshiva, we used to go for an organization called Zichron Menachem, is an organization that helps cancer patients in Israel, and we used to donate platelets. And they used to stick you with a needle and take out your blood and centrifuge it and take the platelets out and then put your blood back in. And for us, it was no issue. As a young 18, 19, 20-year-old, my platelets were very quickly refreshed, but yet this was able to help a cancer patient. And again, that's a huge mitzvah. It took an hour and a half out of my lunch period, big deal. And I was able to save someone's life. So you don't have to do something as earth-shattering as getting a kidney. As Ian says, give blood. We once wanted to actually run a blood drive in shul, but it turned out that it was too expensive to run it in shul for us to be able to do it. And they would need about 300 people to come to shul to give blood to make it worth the NHS's while to come to shul to do it, which is why we didn't do it. But it was one of the ideas that was floated once. And I think lots of people in our community would be willing to go out and to give blood and to help somebody. It's such a simple thing to do.
So when COVID finally goes away, which we hope it all will, or when we've learned how to deal with it more effectively, if we can get 300 people at shul that would all be interested to turn up, that's something we could definitely organize.
Absolutely. Good luck with that.
See, the social committee is just rubbing its hands together, going, finally, the event we've been waiting for.
300 people will come.
Lots of thank yous coming in, which is very nice, and so on. We're just going to read these last comments, and then we will leave you all. Mendy has said that that it is encouraged as long as it will not end the life of a donor, according to halacha. Live kidney donation will save many more lives than post-death. Again, Elliot saying another excellent discussion. Thank you. And Laura Greenberg, thank you. She agrees with the rabbi. We should not put pressure on people. This education is excellent, as with knowledge, we can feel more comfortable with our decision. So my sister is always into food, so she's mentioned, don't forget the free biscuits when you donate blood. Don't forget to check the hechsher on those biscuits as well. And Elaine Bermitz has commented, you also get an hour and a half for lunch if you need to donate blood. So there's definitely some.
That was when I was in yeshiva. We actually had 2 hours, but we also spent 12 hours learning. So it's not, an hour and a half wasn't so bad.
Rivka's commented that blood donor centres are still open in Manchester, only a 10-minute drive. And you can, and Ian's followed that up by saying you can still donate blood even at this time now. Zvi has said, taking on the stance that with brain death it is not allowed, would the prohibition be for the donor, although it is not him carrying out the procedure or the surgeon?
Okay, there's a difficult question. The answer would be for both.
Yeah, okay. But I'm presuming, though, that obviously halacha is not going to apply to majority of surgeons, even though we have quite a few Jewish surgeons as well. Lots of thanks coming in. And again, Adam Sugar showing that his timing and comic timing knows no bounds. Rubbish again. Thank you, Doctor. And that's it. So we're going to end on that note. Rabbi, unless there's anything else, we just need to introduce the topic for next week. So again, we're going to choose something that hopefully is equally worth discussing, but also not easy. But we're going to be talking about Jewish education, aren't we?
Yeah, absolutely. And I think one of the things that I want to discuss next week is Jewish education, and also vis-a-vis sending children to Jewish schools or sending children to non-Jewish schools with external Jewish education. Is there a difference? Are you going to be giving your kids a greater sense of Jewish identity by sending them to a Jewish school? Maybe it doesn't make a difference at all. I've heard from people that sending to non-Jewish schools, their kid had a greater Jewish identity because they felt they were the only Yid around. So what do we say? What's the best way of going about things? Should you always only send your children to a Jewish school? Or maybe we can come up with other ideas of sending children to non-Jewish schools as well, and it's not such a terrible thing.
Okay, well, tune in next week, 8 o'clock on Sunday evening. We'll discuss that again, and I'm sure we'll have some enlightening guests as well. Thank you, everybody, for joining us.
Thank you. Thank you so much.
Bye, Rabbi. Have a great week, everyone.